My name is Olivia and I'm with Modern Practice Solutions. Why are so many dental offices being inspected by OSHA here in Tennessee? Well, let's try to understand the local emphasis program. OSHA's here. Help. Are you frantic? They've walked in the door and they want to inspect your office. If you are practicing in Tennessee, have you experienced an unannounced OSHA inspection? Well, you are not alone. Week to week, dental practices are reaching out to us explaining that Tennessee OSHA inspectors stopped in for a random audit. Quite a number of practices have experienced citations, although such citations only amounted maybe to a few $100s. But what is this all about? Why are so many dental offices being inspected by OSHA? Unfortunately, it's part of the local emphasis program. Tennessee has its own state-run OSHA program, which we refer to as TOSHA, unlike some other states that just follow federal OSHA. State-run programs like Tennessee are often more strict than the federal government, and they take a unique focus, just as Tennessee has. For example, TOSHA has a stricter chemical right to know and bloodborne pathogen standard enforcement. In 2017, TOSHA implemented the local emphasis program specifying targeting dental offices to address the bloodborne pathogen standard and the hazard communication standard. TOSHA studied data collected over a 10-year period between the years 2004 and 2014 and identified several hundred serious hazards after inspecting 30 dental offices with an average of 10 serious violations per office. So as a result, TOSHA launched the local emphasis program. Now, what's interesting is that other industries that are part of the local emphasis program include high noise workplaces and construction sites. So, who would ever think that a dental office would be on the local emphasis program? You would think that a healthcare workplace like a nursing home or hospital settings where there are more injuries reported would be on the list and not dental offices. I mean, let's look at it. In nursing homes where people are lifting other patients, where patients may become combative or they contract illnesses from their patients. Anyway, common dental OSHA violations that TOSHA is finding is failure to provide appropriate training, particularly on bloodborne pathogen standard and hazard communication standard, inadequate personal protective equipment, including failure to provide proper gloves, mask, and eyewear protection, missing or inaccessible safety data sheets for hazardous chemicals in use, as well as improper handling of sharps and medical waste. Based on our experience, TOSHA is specifically addressing multi-site injections as previously noted in prior blogs and articles that we have shared. For example, in the exposure control plan, you must detail more information on how recapping the needle takes place with specific language. So even if you're using the model exposure control plan that OSHA gives you, you would still need to customize it to match your dental workplace setting and incorporate some of the suggested wording that I will provide in the article version of this discussion. Another source of violations are the eye wash stations. What was considered to be compliant for years and years, what is present in thousands of dental offices is no longer passing the grade. According to TOSHA, faucet-mounted eye wash attachment that requires multiple actions, such as turning on the faucet and then pulling the pin, is typically non-compliant because it delays access and may not provide uninterrupted flow or appropriate water temperature, which is supposed to be tepid. Such units are considered supplemental only and do not replace the need for a fully ANSI compliant eye wash or eye face wash station. So what happens after OSHA issues a citation? The employer must post it, review it to either correct the violation or certify abatement, request an informal conference with the area director within 15 days to discuss it or formally contest it. Failure to act means a citation and the penalty will become final. Never feel reluctant to question a citation to assure that the violation is actually lining up to what was observed versus what is the law. We have found some discrepancies where they were trying to cite a small dental office for not filling out the record keeping forms 300, and dental offices are exempt, so it's worth looking into. So I hope that more dental practices will request an informal conference to discuss any potential violations that they observed. You may find TOSHA's frequently asked questions sheet helpful, which we will list the website on the video for you. At Modern Practice Solutions, we've been dedicated to keeping dental offices safe and aligned with OSHA for the last 26 years. I have spent a big part of my life trying to help dental offices stay in compliance. We want you to be safe. We want your employees safe. We want your patients safe. And that means if we have happy dentists, we have happy customers and clients. We appreciate that you entrust us with your compliance, and we hope that we can continue serving you for years and years to come. If you need to reach out to us, 931-232-7738, or visit us online at modernpracticesolutions.com.